好，谢谢张，我们主席张教授。So so I don't know whether I had not attend the others three speakers meeting. So I don't know whether I have any repetitions of of my talk. Anyway, I will finish that within 20 minutes. So my talk will be perspective of the management of COVID-19 in China. Okay. So as you know, up to today, there are 137,000 people infected with all over the world, and with the mortality of 4.1%. So altogether. So I would like to mention some of the main points. First is the transmission features. So as you know, there's human-to-human strong evidence showing human-to-human transmission. There's no need to say more about this. So the first case developed symptoms in January 10th. That's the family, as Australia Chinese, 6 members visit Wuhan, 5 of them, and eventually the last one is also infected. That's a human-to-human, because he had not been in Wuhan. So I think the road of transmission, so of course the direct contact transmissions, the main road of that. But whether they have some other transmission road, so I suppose just now Professor Qiao Jie had mentioned whether they have mother-to-child vertical transmission. No, I don't think so far. Whether they have species transmission, yes, perhaps. As you know, the respiratory road is the main transmission way, and others possible road maybe like feces and urine and contaminant materials and so on. So why I mention that? Because so both in Hong Kong and in Guangdong had these cases with the same block, and then the lower part and the upper part, the different floors, and had transmission. And that means so not only for the face-to-face transmission, but also may have some contaminated material transmission. As you know, the outbreak in Diamond Princess cruise ship, so about 1/3 of them eventually had got infected. So there's no such a big opportunity for people with face-to-face transmission, maybe via the closed circle, like tube, exhaustic tube, or some others transmission. So that's the human-to-human transmission. And a very important point I would like to mention about person without symptoms, they actually had the transmission capacity. So that's a paper and talking about Shanghai, a person in Shanghai visited Germany and attended a business meeting. And some of them had accompanied him to go there. And when he flew back to Shanghai and got symptoms, and eventually 3 days ago, was proved to be infected with COVID-19. And the other companies also get the symptoms. That's the so-called asymptomatic transmission. So that's very important for the screening. So how about the dynamic of transmission? So we usually just use the basic reproductive number, the RO. So as you know, a lot of studies showing the basic reproductive number, the RO. So it's higher than SARS, higher than MERS, even higher than seasonal influenza. That's close to 3. So 1 person infected with 3 persons. So that's quite high of that. And also the very important point is, so at the beginning of the onset of the disease, so say like the first 3 or 4 days, the virus load is pretty high. That's in nasal swab. That's a throat swab. Altogether, the highest in the first 3 or 4 days, and then a subsequent decline. And then after one week, will be going down very remarkably. So virus loads very high in the upper airway at early stage. That may means more contagious in this early stage. And that's what I would like to mention to the audience. So what for this COVID-19 infection, that's high basic reproductive number, it's close to 3, is much higher than the others, and then higher mortality. So for the average 4%, from 0.7% to 7%. So the wide range as compared with influenza, that's 10 times or even 20 times higher than the mortality of influenza. And also a very important point is the asymptomatic virus carrier can have any infectivity. They can transmit the disease to human being. That's very important for us as a prevention strategy. So the earlier stage, the patient's onset, the higher the infectivity. So that will be very much aware for the importer, 输入者. So that's, and also a very important point is keep unobstructed of the sewer or exhausted tube. So 下水道和通风地方都要非常注意. Okay, the second is diagnosis. I think diagnosis, I don't need to say too much about that. So diagnosis of COVID infection in suspected patients, we use double check, real-time PCR for the virus RNA and port for IgM. So the showing that the recent infection. And also very important for diagnosis, a differential diagnosis is between COVID-19 and influenza. Okay. Okay, this is the method. I'm not going to talk too much about this. And this is another quick SARS serum IgM IgG assay kit. So this is a normal person, and this is COVID-1 infection. So the IgM assay here, IgM assay, and this is IgG assay here. So by using this two kind of check, so it's easier to easier to get the 100% of detection. And also in this country, in our country, had developed differential diagnosis using chip-based isothermal amplification and analysis. So I'm not going to talk too much about this. Actually, you can differentiate COVID-19 infection and influenza A, B, and other virus. So one very important point is, so if we meet some importer from the newly outbreak areas, 要是从外国输入者, in few patients we have found, in few patients, they have no symptoms, but using real-time PCR is so strongly positive. So, and also serum IgM is negative. In the early stage, IgM will not showing positive. So this person will ask him to go to the appointed hotel, and he actually developed fever 3 days later. So in other words, simple use IgM or IgG test cannot be used at the moment for screening. So this is, I think it's important. In particular, at this moment, some of the countries as just in the first wave. 所以这条我们觉得非常重要。screening 做一个筛查，但是我们发现呢，最近几天发现有些病人从外地来的，这从其他国家比较高发的国家来的，他没有症状， 但是这个PCR 是强阳性，但是呢，血清的 IgM 是阴性的。血清 IgM 在早期是不一定可能是阳性，所以这个呢是要非常注意啊。So clinical characteristics. So this is a data we collect more than 1,000 cases in China. I'm going to not to talk too much about that. Incubation period is median 4 days, 2 to 7 days. And then I think a very important point is the symptoms of fever and cough. And about 50% are afebrile on admission. So 有50%在入院的时候并没有发烧，发烧不是唯一最主要的金标准。所以radiology showing GGO and bilateral infiltration most common in subpleural location. So and I think laboratory findings, new lymphopenia first, the LDH, increased LDH, and increased direct bilirubin. That's 3 very important points for the diagnosis. And the outcome, of course, in patients with comorbidity, so some other chronic disease, will be 9 times higher than the other cases in getting to a composite endpoint. That means going to ICU or invasive ventilation or death. So how to predict critical ill patients? Our predictive model will be published soon. So that's in addition to X-ray and age and whether they have hemorrhage or dyspnea or something like that. And I think the 3 laboratory indices are very important. Is leukopenia and high LDH and high direct bilirubin. So we can make a prediction and see whether this patient will have a poor outcome. So the management, we have just a few randomized studies. So you can see just published today or yesterday by Professor Cao Bin. And the first nationwide clinical trial have shown the Calitra is show no effective as compared with control. So in terms of the shorten the duration of clinical improvement, as well as the significantly reduce the virus load. So no difference of that. In other words, Calitra show no efficacy of this by this study. And at the moment, we are doing some on the way doing some control study. One is chloroquine, and the second is IL-6 receptor antibody, tocilizumab, and 莲花清瘟胶囊. All right, this Chinese traditional Chinese herbs, and hydrogen oxygen mixed gas inhalation, and convalescent plasma, and remdesivir. This is on the way. So we'll get the result will be coming out in the next 1 or 2 weeks. So this is one thing is chloroquine, and we have the close to the end of the study. And as you can see, the 3D mode chloroquine, this is act to the target of the COVID-19. That's the site is 3CL protein of the COVID-19, and the dose we use 0.5 gram twice a day for 7 days or 10 days, and the plasma concentration is 1.13 micromoles, which is quite close to the EC50. So in other words, it will be working in this way. Some of the other countries now have tested this chloroquine, and also some traditional Chinese medicine is also available. So now available in the market, we have found that some of them is really effective, like 莲花清瘟胶囊, this one. And we have shown in the laboratory showing that in cell lines, it's working it had some antivirus infection, so activity. And you can see here, so 莲花清瘟胶能 exert antivirus activity against COVID-19. This is electron microscopy. I'm not going to talk too much about that. And the convalescence plasma will be going up. My colleagues told me he is doing 100 patients at the moment. So we'll be end up the next week. So this is the first open study. So in first 10 patients, and show this it's really had a good effect on the neutralization antibody before and after convalescence serum plasma infusion. And also RNA test is going all to reduce or become negative of that will be published soon. So special issues of mechanical ventilation, that's in the very serious ill patients. So you can see we as a clinician, we have made some challenge. So remain to be solved. So one is the patient present with exertional dyspnea, 就是呼吸很用劲儿 with normal respiratory rate. So 呼吸频率还是正常的 under HFNC 高流量的这个鼻导管 or 非创伤就是面罩通气。So because this can persist a long time, leading to a delay of intubation. In this kind of patient, the outcome is poor. It's not that good. So if once you have found even the respiratory rate is normal, but if the patient exists with very exertional inspiration dyspnea, so intubation have to be done earlier. The second point is although PF ratio improves soon after intubation, but sometimes we have found this kind of patient will have some difficulty in withdrawing sedative or muscle relaxation because synchronization between patient and ventilator. 病人他虽然插了管以后，这个氧合改善的很快，但是这个病人呢很难测机，为什么？他一测了镇静剂或者一测了集中剂啊，很快就不同步，所以这是一个很大的问题。So the clinical manifestation is quite different from that of SARS. So from our autopsy, we have found just, I'm not going to talk too much about that. We have found just, you can see exudative fluid filling in the alveolar, just like here, you can see. So that's one thing, the very thick mucus. So you can see when you suck out the mucus, that's very viscous mucus. So this is one thing is, so our lesson is to improve the efficacy of mechanical ventilation, early cleaning of viscous mucus in small airway remain to be solved. And probably we can use some N-acetylcysteine lavage, or even nowadays in United States, they use this Parmesan to treat the patient with cystic fibrosis. Whether it will works or not remain to be solved. So we also use the hydrogen-oxygen mixed gas to reduce airway resistance. It shows some efficacy in improve the dyspnea of patients. So lastly, I would like to mention about the China strategy in controlling further spreading. So it seems the time, or we have some expert here with Professor Li, Professor Yun, and Zheng and Gao, and announced in the 20th of January. So that there was definitely human to human transmission, and also confirmed that the medical staff have been infected. Since then, I think the government had taken a strong step to combat of the COVID-19. First is lockdown Wuhan on 23rd. Don't go to Wuhan, don't leave Wuhan. The second, real-time announcement of the number of diagnosed suspected patients every day in each city nationwide. The third is interagency mechanism launched. In other words, that's make everybody should have early prevention, early quarantine, early detection if you have found yourself had some discomfortable. So you have to seek the doctors, and early diagnosis and early isolation. So also very important is quarantine and PCR test is imperative, is be out in close contactors. This is very important. I suppose in the United States had not been this one. I think you should do that. So this is quarantine, not quarantine, that's blocking the Wuhan city. And this, you can see the result. I'm not just very briefly talking about that. That's not done Wuhan at this time. And 2 weeks later, and the number of the patient reaching the peak. This is the peak in the year, the day of 4th of February. That's just 2 weeks time, reaching the peak. And after 4 weeks, or 4 weeks time, return to basic control. I think that's a very effective method. Just lock down the high epidemic area, and then interagency mechanism, the full early nationwide policy will make us much better. So now, so we have a prediction considering the public intervention and migration. So this is the actual number of this one. So we have validated by AI to see. It's quite close to the prediction. And if we have a 5 days earlier alert, the patients much less. If the 5 days later to announce this, we're going up to more than 170,000. So pretty high. So in this way, we need, I suppose, in the United States should have a close interagency mechanism, as have 4 early. That will be much better. Thank you very much.
Thank you, academician Zhong Nanshan, for giving us this excellent presentation in English. Now we come to questions and answers. We have 3 experts joining us from the rest of the world, and they have already prepared 10 questions. The first professor is Professor Paul Rossman, CEO of Johns Hopkins Medicine and Dean of the Medical Faculty of the Johns Hopkins University. Number 1 is Professor David Palmer, professor from the Boston University School of Public Health and Medicine. Number 3 is a GP from Australia, Tonia. In the interest of time, we're not going to get connected with the 3 experts, because before this seminar, we've already had the communication about the questions. We'll just raise the questions, and then we will ask our experts to answer the questions. John, please could you answer question 2 and 3? These are about the treatment.
这个可能这个同传这个不行。So can you hear me now?
Yes.
Okay, right. So about the medicine. So I think just now I mentioned Kaletra showed no efficacy. So actually that's from Hong Kong and some others during the outbreak of SARS. So it shows no efficacy. Maybe the dose being used is lower than in Hong Kong 70 years ago. Can you hear me? Okay, yes. Right. And the second was chloroquine. I think in some of the countries had already trying that, but I think their dose is not that high enough. So we just preferred 500 milligrams twice a day for 7 days. Now it's changed to 7 days, not 10 days. So, okay. And also, I have not found any evidence, any study showing hydroxy chloroquine is showing some efficacy, and any study showing that. 羟氯喹，好像我没有看到有什么研究证明它有这个用处。I just had got study showing the chloroquine, so 氯喹, so that will be different, I think. So that's in other country they have done some work on that. So and also now the Chinese herbs, 莲花清瘟胶囊, I suppose had moved to some other, Iraq or some other countries, because the clinical study has shown so effective in terms of reducing the symptoms and lowering the fever and some others. However, there's a tendency to shorten the virus positive test, shorten the time, but there's no significant difference in between two groups. So anyway, but it did show some improvement of the symptoms and shortening the fever, and it's that. And also the convalescence convalescence plasma of this. So I think the result will be coming out very soon. So at this moment, remdesivir, I think will be a little bit late. So we will have Chao Jie, Professor Chao Jie, now is in doing the study in Wuhan, and as a randomized study. I suppose I expect the effect of his study. I think basically is this kind of drugs. Thank you.
谢谢周院士。下面有请严天院士来回答第1个问题和第9个问题。